Namaste everyone. So today we are going to discuss what are the specific age related considerations for yoga. For children under 3 years old. Usually for children under 3 years old they are not developed. The body is not ready for a structured yoga. Their motor skills, attention span and the understanding of instructions they are still maturing. So any type of yoga practice is generally not recommended for someone who's under 3 years old. For adolescents, they should avoid advanced yoga practices that may place excessive strain on their body. The bones are still developing. So, the growth plates, especially in the spine, they are vulnerable to injury from intense back pain or forceful twists. For adults over 60, aging adults, especially with limited mobility or health conditions, they should avoid poses that require deep flexibility like Uttanasana, standing forward fold, or Chakrasana, the wheel pose, or pigeon pose, Ekapada Rajkapodasana. Balance on one leg with or without support, headstands. So the risk of fall when you are doing this pose or the risk of injury is really high. So yoga can be practiced at any age, but it is important as a yoga teacher, we should be aware of looking at the class and understanding what type of yoga sequence we are going to give to have no injuries and have the class fun filled and make sure that the students get the flexibility, the strength that they need or desire in a particular class. What are the medical conditions that benefit from yoga? Always remember one thing, yoga is not a cure for any disease or medical conditions. It can help, it can aid, it is a accessory to the medical practice. Uh, it is highly beneficial in managing and alleviating symptoms and improving quality of life for many health issues, but it is not a cure. Now we are going to go over a list of medical conditions that yoga has shown to provide significant benefits. But always remember, as yoga teacher, yoga is not a cure. It helps with a consistent lifestyle, preventing a lot of things. But once a person has a disease or a fracture or any medical condition, they have to go to a board certified medical doctor to get that fixed. Mental health conditions, anxiety, depression, PTSD, stress. Yoga can help calm the nervous system, it reduces cortisol. Breathing techniques, they are particularly helpful in managing the high anxiety. Regular yoga practice helps reduce the depression. Traumatic sensitive yoga, which is used as a therapy for people with PTSD, it helps in grounding the individuals and developing a mind body awareness. Yoga's emphasis on breath control, meditation, mindfulness, and asanas help reduce chronic stress, promoting a relaxation and improve mental health. Musculoskeletal conditions, back pain, arthritis, osteoporosis. For students with back pain, yoga strengthens the core and improves the posture. So it helps reduce the chronic lower back pain, especially poses like Marjariasana, Vitalasan, which is cat and cow, or Balasana, the child pose, are very effective. For arthritis, yoga increases the joint flexibility and reduces the pain. It improves the range of motion of individuals with osteoporosis or rheumatoid arthritis. Gentle modified poses help alleviate the stiffness. Osteoporosis. Gentle weight bearing yoga poses help strengthen the bones and reduce the bone density loss. So it lowers the risk of fracture in people with osteoporosis. Sciatica. Yoga stretches and strengthens the muscles around the spine and it helps relieve the sciatica pain by reducing the nerve compression. Cardiovascular and circulatory conditions, high blood pressure. Regular practice of yoga, especially restorative yoga, yin yoga, it helps reduce the low blood pressure by reducing the stress, improving the circulations. Heart diseases, yoga improves the heart health by reducing risk factors such as high blood pressure, high cholesterol, and stress. Hardening of arteries. Yoga helps reduce the progression of the hardening of arteries by improving the circulation. Varicose veins, one of the most common things that you're going to see as a yoga teacher. Certain yoga poses like Viparita Karni, one of the best poses there is to improve circulation in the legs. It helps relieve the symptoms of varicose veins. Respiratory conditions, asthma or COPD. Breathing techniques, pranayama, it really helps strengthen the lung capacity and improves the breathing efficiency. So it helps reduce the asthma symptoms. Metabolic and endocrine disorders, so diabetes, hypothyroidism, or PCOS, polycystic ovary syndrome. So with yoga, diabetes can be controlled or regulated by doing poses correctly. Dhanurasana bow pose is one of the best poses for controlling sugar levels for diabetes. Hypothyroidism, certain yoga poses like Matsyasana, which is going to open your chest, or shoulder stand, really help with hypothyroidism. Digestive disorders, irritable bowel syndrome. Yoga really helps control the digestion of the food that we eat, especially whenever you are doing twisting poses, because it completely concentrates on stretching the digestive organs, pancreas, kidney, liver, gallbladder. When you are twisting on the right side, at that point, the digestive organs on the right side are getting compressed, but the left side are getting stretched. And when you are doing on the left side, the opposite is happening. So you are actually giving a nice workout to these digestive organs. Also, when you are twisting your large intestine and small intestine, they're getting a nice squeeze, a nice workout. It helps promote better digestion and reduces the irritable bowel syndrome. Constipation. Pawan Muktasana is one of the best poses, wind relieving pose to reduce constipation, helps stimulate the bowel movements. Acid reflux. So gentle yoga can help relieve the acid reflux by improving digestion and reducing stress. Neurological conditions. Multiple sclerosis. Yoga helps improve the balance, coordination, and muscle strength, reducing some of the symptoms associated with MS. Parkinson's disease. Yoga helps improve the flexibility, balance, and strength, helping individuals with Parkinson's maintain mobility and reduce muscle rigidity. Epilepsy. While yoga cannot cure epilepsy, it helps reduce the frequency of seizures by promoting relaxation and reducing the stress. Autoimmune disorders such as rheumatoid arthritis or lupus. Yoga helps reduce the inflammation and manage pain by promoting overall joint flexibility. Reproductive and women's health. Menstrual disorders. Yoga can help regulate the menstrual cycle, alleviate the cramps, and balance hormones. Especially Baddha Konasana, butterfly pose, is one of the most commonly recommended poses. Infertility. Certain yoga practices help promote the relaxation and reduce the stress, which may enhance fertility. Yoga also improves the circulation to the reproductive organs. Pregnancy and prenatal health. Prenatal yoga improves the flexibility, strength, and the circulation during the pregnancy. It also helps alleviate some of the pregnancy-related discomforts. Menopause. Yoga helps ease the menopausal symptoms like hot flashes, mood swings, and sleep disturbances by regulating the hormones and calming the nervous system. Chronic pain conditions, fibromyalgia, chronic fatigue syndrome. Yoga helps reduce the widespread pain and fatigue associated with these conditions. Skin conditions, psoriasis, eczema, acne. Since yoga will help reduce the stress level, which is the common reason for occurrence of these diseases, it helps keep the disease under control. Sleep disorders, insomnia, sleep apnea. Yoga can improve the sleep quality tremendously by promoting relaxation and reducing stress. Pranayama, mindfulness really help with the insomnia. Addiction recovery. Substance abuse disorders like yoga and meditation are increasingly used as complementary therapies for in recovery addiction, helping the students to manage the cravings. Smoking cessation. Yoga aids in managing the withdrawal symptoms and reducing stress and anxiety, which can support individuals who are trying to quit smoking. Chronic stress and fatigue. Adrenal fatigue. Yoga reduces chronic stress, which is often linked to the adrenal fatigue. gentle yoga practices can help calm body stress response. So, conclusion, while yoga is adaptable and modified to suit many individual needs, it is not suitable for everyone in all forms. Those with specific medical conditions or injuries, recent surgeries, make sure that they get a clean bill of health from their doctor before practicing yoga, and even after getting a clean bill of health, they need to understand to practice gentle yoga. Do it where it doesn't stress their body out. So it is important for individuals with specific health conditions to consult their physical healthcare professionals and yoga instructors to adapt to the practice that they need. Thank you and namaste.